Hello dears. In this video we will learn about diphtheria, their causes, transmission, symptoms, diagnosis, treatment, and prevention. Let's start the topic. Diphtheria is a serious bacterial infection caused by Corynebacterium diphtheria, which primarily affect the mucous membrane of throat and nose. But can also infect the skin. Corynebacterium diphtheria is a gram-positive, non-spore-forming, rod-shaped, anaerobic bacteria, which contains exotoxin, known as diphtheria toxin. Transmission. It spreads through respiratory droplets, for example, coughing, sneezing, and direct contact with contaminated objects and wounds, but mainly route is oral. Symptoms. Its symptoms includes sore throat, fever, swollen glands, weakness, thickened gray coating in throat or nose, also known as hallmark sign. Complications. If it is left untreated, it can cause breathing problems, heart failure, nerve damage, and also leading to death. Diagnosis of diphtheria. Two methods are used for diagnosing diphtheria, which are: First, clinical examination, searching for hallmark signs, such that sore throat, grayish pseudomembrane on tonsils, pharynx, or nasal cavity. Swollen neck or bull neck, difficulties in breathing and swallowing. Second, laboratory tests, throat or nasal swab culture, staining, such that Gram stain, Albert stain, toxin detection, such that PCR, ELISA, or immunochromatographic strip test, which are used for rapid toxin detection. Treatment of diphtheria, which includes, firstly, use of antitoxin to neutralize the toxin. Secondly, use of antibiotics, like penicillin or erythromycin. Prevention of diphtheria, which includes vaccination, for example, diphtheria taccoid vaccine, which is part of DTaP vaccination series given in childhood. That's all about diphtheria. Thanks for watching the video.